If you're over 60, you might be wondering, do I really need an ECG, a stress test, and a coronary calcium scan every single year? For most people, the answer is not necessarily. Today, let's talk about how heart screening after 60 actually works so you can focus on the testing that truly matters for you and skip the tests that won't change anything. Here's the most important idea to start with. Heart screening after 60 should begin with your overall cardiovascular risk, not with ordering every available test. Age alone does not decide which heart tests you need. Your individual risk does. So what makes up your cardiovascular risk? A few things matter most. Your blood pressure, your cholesterol, your blood sugar, your smoking history, your family history of heart disease, and your kidney health. Together, these paint a picture of how likely you are to develop heart problems, and that picture is far more useful than any single test. If you know these numbers, you and your doctor can make smart decisions. If you don't, even the most advanced scan can't tell the full story. Now let's talk about the tests themselves, because this is where a lot of confusion happens. First, the ECG, also called an EKG. This test records the electrical activity of your heart. It can be very helpful if you have symptoms like palpitations, chest discomfort, fainting, or a suspected rhythm problem. But for a person with no symptoms, an ECG is not a routine screening test that everyone over 60 automatically needs every year. Next, the stress test. A stress test looks at how your heart performs during physical exertion, usually on a treadmill. It can be useful when your symptoms or clinical findings raise concern for coronary artery disease, but in people without symptoms, it is not generally recommended as a routine screening tool. Done without a clear reason, it can even lead to false alarms and unnecessary follow-up tests. Then there's the coronary artery calcium scan, or CAC scan. This one measures calcium buildup in the arteries of your heart. It can genuinely help certain people, especially when you and your doctor are on the fence about a treatment decision, like whether to start a cholesterol medication. In that specific situation, a CAC score can refine your risk and guide the decision. But it is not a test that everyone over 60 automatically needs. Do you see the pattern? Each of these tests has a right time and a right person. The goal is not more testing. The goal is the right testing, the test that is actually likely to change your care. Now, there is one thing that testing decisions should never replace: paying attention to warning signs. Heart problems don't always announce themselves clearly. Pay attention to new or unexplained chest pressure, squeezing, or fullness, especially if it comes on with activity or with shortness of breath. Other signs can include unusual shortness of breath, fainting or near fainting, a new rapid or irregular heartbeat, unexplained fatigue, or swelling in the legs, ankles, or feet. Discomfort can also spread to the arm, shoulder, back, neck, or jaw. And some people, including older adults and women, may have less typical symptoms, such as nausea, lightheadedness, or cold sweats. If something like this happens, that is not the time to wait. Seek medical care. So let's bring it all together. Heart screening after 60 should focus on your individual cardiovascular risk, not on ordering every test on the menu. Know your risk, know your numbers, watch for warning signs, and use additional testing when it is likely to change your care. You do not need every heart test simply because you're over 60. You need the right evaluation for your individual risk. And here is one simple thing you can start today. If you have high blood pressure, a single reading doesn't always tell the full story. Track your blood pressure at home over several days, morning and evening, and bring that pattern to your healthcare provider. It often reveals things that a single office reading can miss. You can use the free blood pressure tracker at milandwellness.com to record your readings and see your trend over time. Thanks for watching. This is educational content only, so please talk with your own healthcare provider about which screenings and tests are right for you. If this was helpful, subscribe for more clear, practical information on staying heart healthy after 60.